All right, so for our next part of our board review series, we're going to talk about random anticipatory guidance that might come up in primary care. So we're going to have a bit of a question-answer format for you playing at home. So how much weight do we expect a newborn to lose? So it's going to be 7 to 10% of their birth weight, and they should regain their birth weight in about 2 weeks. And then how much weight do we expect a newborn to gain over time? So 0 to 3 months, it's going to be 20 to 30 grams per day. 3 to 6 is going to be 15 to 21 grams per day. And 6 to 12 months is going to be 10 to 13 grams per day. So a newborn should, or an infant should double their birth weight by around 6 months, and they should triple it by 1 year. So how much vitamin D should a newborn take? It's going to be 400 international units per day. And basically all newborns should be on supplementation. You need at least 33 ounces of formula in order to get enough vitamin D through your diet. So soy formula. So soy formula is lactose free, is that right? That is correct. So you also want to remember how to mix formula. So remember the word scoop. The word scoop has 2 O's in it. So there are 2 ounces for every 1 scoop of formula, and you're going to put the water in first. Now, how about concentrated formula? So that is this guy right here. How are you going to mix that? It's actually 1-to-1 with water. So here is a chart that gives you some of the recommended volumes of formula. So like most of you probably know, newborns are going to feed more frequently, about 8 to 12 times per day, but smaller volumes, 1 to 2 ounces. By the time you get to 6 to 9 months, most infants will be taking around 7 to 8 ounces, 3 to 4 times per day. So when it comes to breast milk storage, some of these things might come up on your boards. So if you have breast milk at room temperature, it lasts for 4 hours. If it's refrigerated, it'll be 3 to 5 days. Freezer will be 3 months. If you have a deep freezer, it's actually going to last 6 to 12 months. Once it's thawed, you want to use that breast milk within 24 hours. And if you have a partially used bottle, you do not store that for later use. When it comes to formula, if you have the ready-to-feed or concentrated liquid type of formula, you want to refrigerate that, and that will last for about 48 hours once it's opened. Powdered formula will last for 1 month once it's opened. All prepared formula you want to use within 24 hours, and if you have a bottle that's partially used, then you want to consume that within 1 hour. All right, a few more questions about newborns here. So what are the number 1 and number 2 risk factors for SIDS? So number 1, unsafe sleep, and number 2 is actually smoke exposure. And then question that a lot of parents are going to ask, when do babies sleep through the night? It's actually 4 to 6 months. And sleeping through the night is actually defined as sleeping continuously for 6 hours. All right, let's talk a little bit about teeth. So when it comes to primary teeth development, so your lower central incisors are going to be the ones that come first. That's usually between 6 and 10 months. That's followed by your upper central incisors. In general, the big take-home point is going to be if you have no teeth between 12 to 15 months of age, you're going to want to go ahead and refer to a dentist. The AP now recommends using fluoride toothpaste once you have dental eruption. It recommends brushing twice a day. There used to be some concerns about fluorosis, which is ingestion of fluoride. The symptoms tend to be a little bit of stomach ache. You can get some whitening of your teeth. To prevent getting fluorosis, you just want to use a small amount of toothpaste. So in children less than 3 years, it's going to be just enough, like a grain of rice on a toothbrush. If they're between 3 and 6, it's going to be about pea-sized. Delayed dental eruption. So there are a number of genetic conditions associated with delayed dental eruption. Often they have to do with the pituitary gland or rickets. All right, so let's talk about hip dysplasia a little bit. So you should be doing your hip check at every well child check between the newborn visit and 12 months. There are some risk factors that are going to have some specific follow-up actions. So if there is a family history of hip dysplasia and you have a male patient, the recommendation is actually just routine exam. Now, if you have a family history and a female patient, you want to go ahead and do imaging, regardless of what you find on exam. If they are breech and it's a boy, it's optional imaging. If it's breech and a girl, you definitely want to image. In terms of what type of imaging is best, ultrasound is going to be preferred in infants younger than 5 months. Plain films are preferred in older kids. If they're between 4 and 6 months, ultrasounds and x-rays seem to be equally effective in making the diagnosis of dysplasia. A few other random newborn hygiene reminders. So nail cutting, you want to keep baby's nails trimmed so they don't scratch their face. And you can use a nail file or a baby nail clipper for that. And when it comes to dressing, a good rule of thumb is to dress the baby in one more layer of clothing than you would be wearing to be comfortable in that same environment. And you want to avoid bulky coats in the winter for infants to avoid having improper fitting into a car seat or suffocation in a car seat. All right, let's move on to the toddler age group. So a few more questions. So what is our ideal milk intake for this group? It's going to be 16 to 24 ounces. What is the leading cause of death for US children after that first year of life? It's actually going to be injury. And what do you do for thumb sucking under 5 years? The answer is you actually don't have to do anything. When it does come to treating someone who is a thumb sucker, you could do a couple of things. You could put a Band-Aid on their finger to try and just remind them that they don't want to suck their thumb. You could use a sticker chart or a token economy to try and reinforce non-thumb sucking behaviors. And then you could do distractions, so maybe having a patient hold a ball or sit on their thumb when they're thinking about sucking their thumb. So something that often comes up is when are they ready for solids? So you can do solids as early as 4 months, but there's a few developmental milestones that you want to make sure a patient is meeting. They need to be a supported sitter. They want to go ahead and open their mouth when the food approaches. They don't want to push the food away with their tongue, and they want to be interested and engaged. So that typically is going to occur sometime between 4 and 6 months of age. So what are some typical first solid foods? So rice cereal is a great option. Vegetables and fruits. Meats are a good option, especially for breastfed babies, because it's a great source of iron. And you want to wait 3 to 5 days between introducing new foods so you can monitor for any sort of reaction that might suggest an allergy. There's a few types of home-prepared baby foods that you're going to want to avoid. So those include things like spinach, beets, green beans, squash, and carrots, because they can have a large amount of nitrates in them. All right, a few more questions here. So if you have a 12-month-old, does not respond to his name, is that normal? It's actually not normal. So most kids are going to respond to their names by around 6 months of age and should most definitely be responding between 9 and 12 months. So how many words should a 20-month-old know? Around 20 words, so it's easy to remember. 20 words at 20 months. There's usually a language or an explosion in a baby's language somewhere between 18 and 24 months. So by the time they're 24 months, you're looking more for about 100 to 200 words. This is the time when infants start putting words together, so 2-word sentences, and they'll start using verbs and adjectives, so it won't be just nouns. And when should speech be fully understandable? So that's 4 years. So the general rule is by 2 years it should be at least 50% understandable by a stranger. By 3 years it should be 75%, and by 4 years it should be 100% understandable by a stranger. So what age can you start timeout? So actually some say that you can start timeout as early as 12 months, that the average age is going to be closer to 2, and the AAP recommends using timeout as a strategy between 2 and 5 years of age. Remember, timeout is for severe behaviors. The way timeout works is really the positive reinforcement that occurs outside of the situation, as well as the active ignoring, and then you can use the timeout for severe situations. All right, let's talk about the outdoors a little bit. So when it comes to sun exposure, for kids less than 6 months, you just want to keep them fully covered. You can start using sunscreen in kids greater than 6 months, but you want to go ahead and reapply every 2 hours. Insect repellent, it's actually okay to use on children greater than or equal to 2 months. And the percent DEET is going to be based on how long the individual is going to be outside, and it's safe to use a DEET type repellent in children this age. All right, so one recommendation I would have for you is Zitelli's Atlas is a common source of images that appear on the board exam. So maybe a week or two before, I would just flip through and look at all the images and go ahead and read the captions. So I'm going to go ahead and go through a few of those right now. All right, so this gentleman, so this is a 7-year-old. He comes into clinic, he's got learning difficulties in school, and they're asking what your diagnosis is. So a few things you might want to notice about him. He has sort of small palpebral fissures, some microcephaly. He has sort of a flat nasal bridge, flat philtrum, some micronathia. So this patient has fetal alcohol syndrome. Here are some of the other features that you can see. So also a thin upper lip, and they could have some minor ear anomalies. How about this patient? So you see this on your skin exam. The family has been using an antifungal ointment without much success. So what's your treatment? So this is actually nummular eczema, also called discoid eczema. So these lesions tend to be round or coin-shaped. A lot of families will believe this is ringworm because of its circular appearance. However, it will not have any sort of central clearing associated with it. And it's most common on the extremities. All right, here's a patient. Let's say this is a patient you are seeing in the springtime, was a premature patient who was exclusively breastfed, and on exam you noticed these widened wrists. So this could actually be a sign of rickets. So vitamin D plays a key role in bone development, and your two main sources are going to be sunlight and food. Like we talked about, you want to go ahead and supplement vitamin D in all of your breastfed babies and those who are not taking up to 33 ounces of formula. The peak season for this to present is primarily going to be the spring, again, because sunlight can be a major source of vitamin D. So some of the exam findings you might see is you can have widening of the long bones like we saw in that last image. You could have the sort of rachitic rosary or the costochondral beating. You can have bowing of the legs, the forearms, delayed fontanelle closure, frontal bossing, and you can have craniotabes, which is softening of your calvarial bones. All right, last image here. So this is an 18-month-old you are seeing in clinic. They've been taking about 36 ounces of milk a day, and they're kind of a picky eater. So this exam finding would suggest anemia, so the hemoglobin's not really meeting the oxygen demands of the patient. So this is common in kids this age who are picky eaters, are taking excessive milk. You're going to see a microcytic hypochromic anemia, and the treatment is going to be iron supplementation. So it's between 3 to 6 mg per kg per day. You want to encourage them to decrease that milk intake. Like we talked about, the ideal amount for a toddler is going to be 16 to 24 ounces each day. And you want to encourage iron-rich foods. That includes things such as meats, beans, fortified cereals, and fish. You want to check a CBC about 1 month after you start your iron supplementation. The first thing that you should see is the hemoglobin go up. It should go up by about 1 in a patient that has iron deficiency anemia that's adequately being treated. So once a patient normalizes, you want to go ahead and continue the iron supplementation for 2 to 3 months following resolution to help replete iron stores. All right, and that's it for the anticipatory guidance section for Gen Peds. Good luck, everyone.